Hi, I'm Tracy Lachalier, Advancement Officer with the College of Nursing.
Hi, I'm Dr. Phil Woods, the Associate Dean for Research, Innovation and Global Initiatives in the College of Nursing.
We are here to share with you some insight into the research community here at the College of Nursing. Dr. Woods, what can you say about our research community?
I think in the College of Nursing we have an ever-growing, vibrant research community. Research and scholarly initiatives extend provincially, nationally and globally. It involves extensive interprofessional partnerships with communities, healthcare providers, health research funding bodies and other educational institutions and units. Research and scholarship informs our faculty's very diverse professional practice areas. I think a very important point also is that over 90% of our faculty are now prepared at the PhD level, which is quite different than the previous years. At the heart of all our research in the college is human health, as one can imagine. This research and scholarship, through effective knowledge translation, impacts practice, health services, policy, ethics and education. Research and scholarship in the college is divided into four very general themes and interrelated areas, and their environments, global, diversity and across the lifespan. Both in the College of Nursing and at the University of Saskatchewan there is a very interprofessional and collaborative research community. This is really important because it ensures for a more holistic and comprehensive approach to healthcare.
Okay. Where is the College of Nursing currently doing research at the local level, nationally, internationally?
I think it's probably best to approach this from the three different levels. So I'll talk first about locally. I think research is going on in most health regions around the province at various times in the year. It takes place in hospitals, community clinics, mental health units, in home care, nursing homes and other agencies around the province. It takes place in schools, in correctional institutions, Aboriginal communities, in the cities, in the rural areas. I think probably in most of the communities and agencies around the province, sometime the college will have been involved in some research. Nationally, our faculty collaborate with other universities and government organisations on interprovincial projects, often undertaking the Saskatchewan arm of that project, being the principal investigator for that part of the research. Internationally, well, this seems to be a very ever-growing list of research and future research. I think I can probably confidently say that projects are definitely ongoing at the moment with faculties either principal investigators or co-principal investigators or co-investigators in the Caribbean, Kenya, Tanzania, the Philippines, India, Peru, Europe, United States, and they're just a few examples. I guess I probably missed a few off. Projects I know for sure are developing in Australia, Ethiopia, the circumpolar region, and they're just a few examples, and many other countries globally. So quite a lot of research going on at all three levels.
Excellent. In what ways does research make a difference?
I think in a number of ways. It certainly helps us to understand and improve the community we live in. As nurses, we are dedicated to making people healthy, so obviously it makes a real difference there from the research that I talked about in some of the earlier responses to the questions. For nursing, it helps us to understand and develop our practice and ultimately improve patient care in our healthcare systems, I think.
Always the goal, I
Yeah, always a goal, yeah. Research makes a difference to everyone, whether they realise it or not, I guess. It can empower people. Research, it can give them evidence that they need. It can also perhaps provide some direction to move forward.
Make changes if we need to do things differently.
Or maybe not.
Or maybe not.
Yeah.
What opportunities does the College of Nursing have for undergraduate students who are interested in the research area?
Oh, at the undergraduate level, we have two real streams, I suppose. Those that are funded through the college, that we get money for that, and those that are obviously from faculty funding that they bring in. So first of all, there's the USTEP, the University of Saskatchewan Summer Student Employment Programme, which we're currently working on offering employment to 4 students this year. So 2 of these will be research assistant positions where the students will be working directly on a research project with a faculty member over the summer. The other one is a Canadian Institute of Health Research, CIHR, Health Professional Student Research Award, which we usually get one award each year, and again it provides opportunity for a student to work over the summer months with a faculty member full-time on a research project. Also, individual faculty will employ students through research grants that they get, and these will be at the undergraduate level, and also, as you'll see later, at the graduate level. And sometimes faculty will also involve undergraduate students through their practicums in some of the research projects that they're doing as part of their professional practice and the teaching that they do.
And what about for graduate students?
The graduate, I suppose the first opportunity is for those that are doing the thesis route for the master's programme or for the PhD students. They get an opportunity to do their own research project with the guidance and the support and the mentorship of our faculty. That's a good opportunity for them. Faculty are always looking for graduate students to work on their research projects that they get funding for. So that's another good opportunity. There's also opportunities for graduate students to apply under their own name for very prestigious scholarships from Tri-Council and other funding agencies. Again, usually working on a project of their own or maybe as part of a faculty research programme. And of course, once graduated from the PhD, there's a postdoctoral fellowships that are available for students to apply for.
So what should students be doing to prepare for a career in research?
Interesting question. I think if for somebody that wants to be a nurse researcher, one of the most important things they can do is get a very good grounding in a clinical practice area or other area where they're going to want to do the research in. It's much better to really be an informed clinical researcher than to be somebody that really doesn't understand the contextual issues of where they're researching. So they're working from an informed position, so it really helps them to move some of the work forward. As for education, well, one of the best ways to learn about research is by doing research. Of course, do well in your undergraduate research methods and stats courses. Listen to your professors if you do not understand. Keep trying until you do. Maybe read some more, ask some questions. Obviously apply for undergraduate research opportunities. That's a good way of learning about research because you're actually doing research. There's also quite a bit to learn about the literature review and other research that you might do as part of your term papers. It really gives you a good understanding of how to critically review published research. And it develops your critical appraisal skills. And I probably learned more about research methods through doing a funded systematic review of the literature. Because you really had to understand what the ins and outs were of the research methods that they use. So from two perspectives, I guess.
Okay, great. So if you are a student interested in the area of research, please feel free to talk to one of your professors and they can guide you in the right direction and provide you with the information on all the opportunities that we have here at the College of Nursing. Also, check out the People page on our website. We have faculty profile pictures and information on their research activities. So thank you for joining us today.
Thank you.